Question 1. Benchmark analysis indicates that a 12-year-old canine patient with pre-existing cardiac disease and mild renal insufficiency has undergone a complex orthopedic repair. The surgeon is developing the postoperative monitoring plan. Which of the following approaches best aligns with current best practices for managing such a patient? Option A. Focus monitoring efforts solely on orthopedic stability and wound healing, as these are the primary surgical concerns. Option B. Implement a standardized postoperative monitoring protocol that includes vital signs every 4 hours for all surgical patients. Option C. Develop a monitoring plan that specifically targets parameters indicative of cardiac and renal compromise, alongside general anesthetic recovery indicators, with frequency adjusted based on patient stability. Option D. Monitor only for obvious signs of pain or distress, as the patient is otherwise stable. Correct answer is C. Develop a monitoring plan that specifically targets parameters indicative of cardiac and renal compromise, alongside general anesthetic recovery indicators, with frequency adjusted based on patient stability. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary surgery: managing postoperative risk in a patient with multiple comorbidities. The complexity arises from balancing the need for vigilant monitoring against the potential for iatrogenic stress or complications from excessive intervention. The surgeon must synthesize information from the patient's history, the surgical procedure itself, and the evolving physiological status to tailor a monitoring plan that is both effective and appropriate, avoiding both under-monitoring and over-monitoring. Correct approach analysis. The correct approach prioritizes a risk-stratified, evidence-based monitoring plan. This aligns with the American College of Veterinary Surgeons, ACV's, commitment to advancing surgical standards through scientific rigor and ethical practice. A plan that considers the specific risks associated with the patient's comorbidities, e.g., cardiac compromise, renal insufficiency, and the surgical procedure, e.g., potential for hemorrhage, infection, pain, allows for targeted observation of key physiological parameters. This proactive, individualized approach minimizes unnecessary interventions while maximizing the early detection of potential complications, thereby upholding the veterinarian's duty of care and commitment to patient welfare as espoused by veterinary professional guidelines. Incorrect approaches analysis. Implementing a standardized, one-size-fits-all monitoring protocol for all patients regardless of their individual risk factors fails to acknowledge the unique physiological status of each animal. This approach can lead to either inadequate monitoring of high-risk patients or excessive, potentially harmful, and costly monitoring of low-risk patients, deviating from the principle of individualized patient care. Relying solely on the absence of overt clinical signs to guide monitoring is a reactive strategy that can miss subtle but significant physiological deterioration. This approach neglects the importance of objective physiological data in early detection and can lead to delayed intervention, potentially compromising patient outcomes and falling short of the expected standard of care. Focusing exclusively on the most common postoperative complications without considering the specific risks posed by the patient's comorbidities overlooks critical vulnerabilities. This narrow focus can result in the failure to monitor for complications that are less common but highly probable given the patient's underlying health issues, thus failing to provide comprehensive patient management. Professional reasoning. Professionals should approach postoperative monitoring by first conducting a thorough risk assessment. This involves evaluating the patient's pre-existing conditions, the nature and duration of the surgical procedure, and any intraoperative complications. Based on this assessment, a tailored monitoring plan should be developed, focusing on parameters most likely to indicate early signs of compromise relevant to the individual patient. This plan should be dynamic, allowing for adjustments based on the patient's response and evolving clinical status. Continuous reevaluation of the risk-benefit ratio of monitoring interventions is essential to ensure optimal patient care. Question 2. Risk assessment procedures indicate that during a complex abdominal closure, significant tension is present across the facial edges, threatening the integrity of the primary suture line. Which of the following approaches best mitigates the risk of wound dehiscence and associated complications while adhering to fundamental veterinary surgical principles? Option A. Secure the facial edges with a single layer of strong, non-absorbable sutures placed in a continuous pattern, pulling each throw tightly to achieve immediate, tension-free apposition. Option B. Employ a layered closure technique, utilizing a continuous or interrupted suture pattern with appropriate suture material to distribute tension across multiple tissue planes, and consider tension-relieving incisions if necessary to reduce strain on the primary facial closure. Option C. Rely solely on subcutaneous tissue closure to approximate the facial edges, as this layer is more forgiving of tension. Option D. Perform extensive undermining of the facial edges to create a large mobile flap, then close with widely spaced sutures to allow for swelling. The correct answer is B. Employ a layered closure technique, utilizing a continuous or interrupted suture pattern with appropriate suture material to distribute tension across multiple tissue planes, and consider tension-relieving incisions if necessary to reduce strain on the primary facial closure. Explanation. This scenario presents a common challenge in veterinary surgery, where a fundamental surgical principle, the management of tissue tension, directly impacts patient outcomes and the integrity of the surgical repair. The surgeon must balance the need for secure closure with the risk of compromising vascular supply and promoting dehiscence. Careful judgment is required to select the most appropriate technique that minimizes these risks. The correct approach, utilizing a layered closure with appropriate suture material and tension-relieving techniques, represents best professional practice because it directly addresses the underlying biomechanical forces at play. This aligns with established principles of wound healing and surgical technique, aiming to reduce tension on the primary closure line, thereby promoting optimal tissue apposition and minimizing the risk of complications such as dehiscence, infection, and excessive scarring. Adherence to these fundamental surgical principles is implicitly expected under the broad ethical and professional standards governing veterinary surgical practice, ensuring patient welfare and successful surgical outcomes. An incorrect approach that involves aggressive tensioning of sutures to achieve primary apposition without considering the vascular compromise it creates is professionally unacceptable. This failure to account for tissue perfusion directly violates the principle of do no harm and can lead to ischemic necrosis of the wound edges, significantly increasing the likelihood of wound dehiscence, infection, and ultimately, a failed surgical repair. Such an approach demonstrates a lack of understanding of basic surgical physiology and wound healing, which is a critical deficiency for a board-certified surgeon. Another incorrect approach, such as relying solely on a single layer of sutures with excessive tension, neglects the importance of distributing tension across multiple tissue planes. This can lead to suture tearing through tissue, further exacerbating tension and increasing the risk of complications. Ethically, this demonstrates a disregard for established surgical best practices that prioritize patient safety and optimal healing. Finally, an approach that involves excessive undermining of tissues without adequate consideration for hemostasis and the potential for seroma formation can also be problematic. While undermining can relieve tension, it must be performed judiciously and in conjunction with appropriate wound management techniques to avoid creating a suboptimal healing environment. Failure to do so can lead to complications that compromise the surgical outcome, reflecting a lapse in comprehensive surgical planning and execution. A professional decision-making process for similar situations should involve a thorough preoperative assessment of tissue quality and tension, a clear understanding of the biomechanics of the surgical site, and the selection of appropriate surgical techniques and materials. This includes considering alternative closure methods, tension-relieving incisions, and the use of appropriate suture patterns and sizes to achieve secure closure without compromising tissue viability. A systematic approach, prioritizing patient welfare and evidence-based surgical principles, is paramount. Question 3. Quality control measures reveal that a recent soft tissue surgery patient, a canine with a complex abdominal mass excision, has been discharged with minimal post-operative evaluation beyond a visual inspection of the incision. The owner has been provided with general post-operative instructions, but no specific guidance on monitoring for signs of internal complications or delayed healing. Which of the following approaches best reflects the expected standard of care for post-operative management in this context? Option A. Relying solely on the owner's subjective report of the patient's well-being during a brief phone call a week post-discharge. Option B. Conducting a follow-up appointment only if the patient exhibits obvious signs of distress or a visibly deteriorating incision. Option C. Discharging the patient with only a written handout on general wound care and assuming the owner will contact the clinic if any issues arise. Option D. A comprehensive post-operative assessment including physical examination, diagnostic imaging as indicated, and clear, detailed instructions for the owner on monitoring for specific complications and when to seek immediate veterinary attention. The correct answer is D. A comprehensive post-operative assessment including physical examination, diagnostic imaging as indicated, and clear, detailed instructions for the owner on monitoring for specific complications and when to seek immediate veterinary attention. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient response to surgical interventions and the potential for unforeseen complications. The veterinarian must balance the immediate need for surgical correction with the long-term implications for the animal's welfare and the owner's expectations. The complexity arises from the need to assess not only the technical success of the surgery, but also the patient's overall recovery trajectory and the potential for delayed sequelae, all within the framework of established veterinary surgical standards and ethical obligations. Correct approach analysis. The correct approach, which involves a comprehensive post-operative assessment including physical examination, diagnostic imaging, and patient monitoring, represents best professional practice. This aligns with the American College of Veterinary Surgeons, ACV's, commitment to advancing the science and art of veterinary surgery. Such a thorough evaluation ensures that any deviations from expected recovery are identified promptly, allowing for timely intervention and optimization of patient outcomes. This proactive approach is ethically mandated to uphold the principle of beneficence and avoid harm. Incorrect approaches analysis. One incorrect approach would be to solely rely on the immediate post-operative appearance of the surgical site as an indicator of success. This fails to account for potential internal complications, delayed healing, or the development of complications that may not be immediately apparent. Ethically, this approach neglects the veterinarian's duty of care to monitor the patient throughout the recovery period, potentially leading to delayed diagnosis and treatment of serious issues, thus violating the principle of non-maleficence. Another incorrect approach would be to discharge the patient without providing detailed post-operative care instructions to the owner. This creates a significant risk of owner noncompliance, which can directly impact the surgical outcome and patient recovery. From a professional standpoint, this demonstrates a failure to adequately inform and educate the client, a cornerstone of responsible veterinary practice and client communication, which is implicitly expected within ACV's standards of care. A third incorrect approach would be to dismiss owner concerns about the patient's recovery without further investigation, attributing any observed issues to normal post-operative discomfort. This dismisses valuable client input and can lead to a failure to recognize subtle but significant complications. Ethically, this demonstrates a lack of respect for the client's observations and a potential disregard for the patient's well-being, contravening the veterinarian's obligation to thoroughly investigate all patient concerns. Professional reasoning. Professionals should adopt a systematic approach to post-operative care, beginning with a clear surgical plan and extending to a detailed recovery protocol. This involves anticipating potential complications, establishing clear communication channels with owners, and conducting thorough follow-up assessments. Decision-making should be guided by evidence-based practices, patient-specific factors, and a commitment to ethical principles, ensuring that the highest standard of care is consistently provided. Question 4. Process analysis reveals a 7-year-old Labrador retriever undergoing a complex abdominal exploratory surgery for suspected neoplasia. During manipulation of the spleen, significant, diffuse oozing from the splenic parenchyma begins, which is not readily controlled by direct pressure or standard electrocautery. The patient's heart rate is increasing, and blood pressure is beginning to decrease. What is the most appropriate immediate management strategy? Option A. Cease all surgical manipulation and initiate immediate transfusion of packed red blood cells while awaiting further diagnostic results for coagulopathy. Option B. Immediately pack the abdomen with laparotomy sponges and close the abdomen to allow for stabilization in the recovery area. Option C. Administer a broad-spectrum antibiotic and continue with the planned dissection of the abdominal masses, assuming the bleeding will resolve spontaneously. Option D. Administer intravenous crystalloid boluses and consider topical hemostatic agents while continuing to meticulously identify and ligate bleeding vessels and prepare for potential splenectomy. Correct answer is D. Administer intravenous crystalloid boluses and consider topical hemostatic agents while continuing to meticulously identify and ligate bleeding vessels and prepare for potential splenectomy. Explanation. This scenario presents a common yet critical challenge in veterinary surgery, managing intraoperative hemorrhage in a complex patient. The professional challenge lies in the need for rapid, informed decision-making under pressure, balancing the immediate need to control bleeding with the potential for systemic complications and the long-term well-being of the patient. The surgeon must consider not only surgical technique, but also the patient's physiological status and the available resources. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based management. It involves a systematic multimodal strategy that addresses the immediate bleeding while also considering the underlying causes and potential sequelae. This aligns with the core ethical principles of veterinary medicine, including beneficence and non-maleficence, and adheres to the standards of care expected within the American College of Veterinary Surgeons (ACVS) framework, which emphasizes thorough assessment, appropriate intervention, and meticulous post-operative monitoring. The ACVS certification process implicitly requires adherence to established surgical principles and best practices for patient management, including hemostasis. An incorrect approach that solely relies on aggressive cautery without addressing potential coagulopathies fails to consider the systemic factors contributing to hemorrhage. This could lead to further tissue damage, increased risk of infection, and a failure to resolve the underlying issue, potentially violating the principle of non-maleficence. Another incorrect approach that involves immediate cessation of surgery to stabilize the patient without adequate intraoperative hemorrhage control could lead to irreversible hypovolemic shock and death, demonstrating a failure in immediate life-saving intervention. A third incorrect approach that focuses solely on packing the wound without identifying and addressing the source of bleeding is a temporary measure that does not resolve the problem and can mask ongoing blood loss, potentially leading to delayed recognition of critical complications and a breach of duty of care. Professionals should employ a structured decision-making process that includes 1. Rapid assessment of the bleeding source and severity. 2. Consideration of the patient's hemodynamic status. 3. Evaluation for potential coagulopathies. 4. Selection of appropriate hemostatic techniques based on the identified cause and location of bleeding. 5. Judicious use of fluids and blood products if indicated. And 6. Continuous monitoring and reassessment throughout the procedure and into the post-operative period. This systematic approach ensures that all relevant factors are considered, leading to the most effective and safest management of intraoperative hemorrhage. Question 5. Compliance review shows that a veterinary surgeon is preparing to perform a complex gastrointestinal surgery on a patient with significant concurrent medical conditions. The surgeon has identified potential surgical complications, including anastomotic dehiscence and post-operative sepsis. Which of the following approaches best aligns with the ethical and professional standards expected by the American College of Veterinary Surgeons in managing this high-risk scenario? Option A. Conduct a thorough preoperative risk assessment, meticulously plan the surgical approach considering the patient's comorbidities, and establish a detailed post-operative monitoring and management plan. Option B. Prioritize the most technically straightforward surgical technique to minimize operative time, assuming this will reduce overall patient risk. Option C. Proceed with the surgery as planned, relying on the surgeon's extensive experience to manage any intraoperative or post-operative issues as they arise. Option D. Delegate the majority of post-operative care to the veterinary technicians without direct, frequent surgeon oversight, to allow the surgeon to focus on other cases. The correct answer is C. Proceed with the surgery as planned, relying on the surgeon's extensive experience to manage any intraoperative or post-operative issues as they arise. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent risks associated with gastrointestinal surgery in a veterinary patient, particularly when considering potential complications like dehiscence and sepsis. The surgeon must balance the immediate need for surgical intervention with the long-term well-being of the patient and the owner's expectations. The complexity arises from the need to accurately assess the risk-benefit ratio, select the most appropriate surgical technique, and implement robust post-operative care protocols, all while adhering to professional standards and ethical obligations. Correct approach analysis. The correct approach, which involves a thorough preoperative risk assessment including patient stability, concurrent disease, and the specific nature of the gastrointestinal pathology, followed by meticulous surgical technique and comprehensive postoperative monitoring, represents best professional practice. This aligns with the American College of Veterinary Surgeons, ACV's, commitment to advancing the art and science of surgery through rigorous training, ethical conduct, and evidence-based practice. Specifically, the ACV's emphasizes a commitment to patient welfare, which necessitates a proactive approach to risk management and complication avoidance. This includes informed consent, which is implicitly part of a thorough risk assessment, ensuring the owner understands the potential outcomes and the rationale behind the chosen surgical plan. Incorrect approaches analysis. One incorrect approach would be to proceed with surgery without a comprehensive preoperative risk assessment, focusing solely on the immediate surgical need. This fails to uphold the ACT's standard of care by potentially overlooking critical patient factors that could significantly increase surgical risk or contraindicate surgery altogether. Ethically, this could be considered a failure to obtain adequate informed consent if the owner is not fully apprised of the patient's specific risks. Another incorrect approach would be to select a surgical technique based on personal preference or ease of execution, rather than the specific pathology and patient factors identified during the risk assessment. This deviates from the ACT's principle of evidence-based practice and could lead to suboptimal outcomes or increased complications, thereby compromising patient welfare. A third incorrect approach would be to neglect detailed postoperative monitoring and management, assuming the surgical procedure itself is the sole determinant of success. This overlooks the critical role of postoperative care in preventing and managing complications, which is a cornerstone of responsible surgical practice as espoused by the ACVs. Failure to monitor adequately can lead to delayed recognition of life-threatening complications like sepsis, which is a direct violation of the duty of care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient evaluation. This includes a thorough history, physical examination, and appropriate diagnostic imaging and laboratory tests to fully understand the patient's condition and overall health status. Following this, a detailed risk-benefit analysis should be performed, considering the specific gastrointestinal pathology, the patient's comorbidities, and the potential risks and benefits of surgical intervention versus medical management. The chosen surgical plan should be tailored to the individual patient and the specific pathology, utilizing techniques supported by current veterinary surgical literature. Finally, a robust postoperative care plan must be established, including vigilant monitoring for complications and prompt intervention if necessary. This structured approach ensures that patient welfare is prioritized and that surgical interventions are performed to the highest professional standards. Question 6. Market research demonstrates that a significant portion of veterinary surgeons face challenges in developing anesthetic protocols for patients with complex comorbidities. A board-certified veterinary surgeon is preparing to perform a complex orthopedic procedure on a 12-year-old Labrador retriever with diagnosed chronic kidney disease and mild mitral valve insufficiency. The surgeon is considering several approaches to anesthetic risk assessment and protocol development. Which of the following approaches best aligns with current best practices and ethical considerations for veterinary anesthesia in this context? Option A. Select the most cost-effective anesthetic agents and supportive care measures available to minimize the overall expense of the procedure, assuming standard protocols are generally safe. Option B. Conduct a thorough review of recent peer-reviewed literature and current veterinary anesthesia guidelines, specifically addressing anesthetic management in patients with renal and cardiac compromise, and tailor the protocol based on this evidence and the patient's specific findings. Option C. Delegate the primary responsibility for anesthetic risk assessment and protocol development to the surgical technician, who has several years of experience assisting in anesthesia. Option D. Develop an anesthetic protocol based on the surgeon's extensive personal experience with similar orthopedic procedures in older dogs, prioritizing familiar drugs and techniques. Correct answer is D. Develop an anesthetic protocol based on the surgeon's extensive personal experience with similar orthopedic procedures in older dogs, prioritizing familiar drugs and techniques. Explanation. This scenario is professionally challenging due to the inherent risks associated with anesthetic procedures, particularly in a patient with pre-existing conditions that can significantly alter physiological responses. The veterinarian must balance the need for surgical intervention with the potential for adverse anesthetic events. Careful judgment is required to select an anesthetic protocol that minimizes risk while ensuring adequate patient comfort and surgical conditions. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment. This aligns with the core ethical principles of veterinary medicine, emphasizing patient welfare and the avoidance of unnecessary harm. Specifically, it reflects the professional obligation to stay abreast of current anesthetic literature and guidelines, which are continuously evolving. The American College of Veterinary Surgeons, ACVS, certification implicitly requires adherence to the highest standards of patient care, which includes evidence-based anesthetic management. This approach demonstrates due diligence and a commitment to providing the safest possible anesthetic plan tailored to the specific patient's needs and the surgical procedure. An incorrect approach that relies solely on historical personal experience without considering current literature or the patient's specific comorbidities is professionally unacceptable. This failure to adapt to evolving knowledge and individual patient needs can lead to suboptimal anesthetic choices, increasing the risk of complications. Ethically, it breaches the duty of care by not utilizing the most current and appropriate information available. Another incorrect approach that involves selecting the cheapest available anesthetic agents without regard for their pharmacokinetic profiles, potential side effects, or suitability for the patient's condition is also professionally unacceptable. This prioritizes cost over patient safety, which is a clear violation of ethical veterinary practice and the Act's standard of care. It demonstrates a lack of professional responsibility and a disregard for the potential harm to the patient. A third incorrect approach that involves delegating the entire anesthetic risk assessment and protocol selection to a less experienced technician without direct veterinary oversight is also professionally unacceptable. While technicians play a vital role in anesthesia, the ultimate responsibility for patient safety and protocol selection rests with the licensed veterinarian. This abdication of responsibility is a significant ethical and professional failure. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's signalment, history, physical examination findings, and diagnostic results. This information should then be used to identify potential anesthetic risks. The veterinarian should consult current peer-reviewed literature and establish guidelines for anesthetic management of patients with similar conditions. Based on this comprehensive assessment, an individualized anesthetic plan should be developed, considering drug choices, dosages, monitoring parameters, and contingency plans for potential complications. This process ensures that the anesthetic protocol is tailored to the specific patient and surgical procedure, thereby maximizing safety and patient welfare. Question 7. Compliance review shows a veterinary surgeon is considering using a newly developed orthopedic implant for a complex fracture repair in a large breed dog. The implant is marketed as having superior strength and faster integration properties, but there is limited peer-reviewed literature available on its long-term clinical performance in canine patients. The surgeon is aware of several established implant systems with extensive clinical data and a proven track record of success in similar cases, though these may be more costly or require slightly longer surgical times. What is the most appropriate course of action based on the principles of orthopedic surgery and the standards expected for ACVS certification? Option A. Select the least expensive implant option to manage costs, even if it means compromising on some biomechanical properties or historical performance data. Option B. Employ the novel implant because of its perceived technological advancement and plan to gather data for future publication on its performance. Option C. Utilize an established implant system with a robust body of scientific evidence supporting its efficacy and safety for the specific orthopedic condition, prioritizing predictable long-term outcomes for the patient. Option D. Proceed with the novel implant, assuming its advanced design will lead to superior results, despite the limited clinical data available. The correct answer is C. Utilize an established implant system with a robust body of scientific evidence supporting its efficacy and safety for the specific orthopedic condition, prioritizing predictable long-term outcomes for the patient. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic surgery, where a surgeon must balance the immediate need for surgical intervention with the long-term implications of implant choice and potential complications. The professional challenge lies in making an informed decision that prioritizes patient welfare, adheres to established surgical principles, and complies with the standards of the American College of Veterinary Surgeons, ACVS, regarding evidence-based practice and patient safety. The surgeon must consider not only the technical aspects of the surgery, but also the ethical responsibility to use materials and techniques that are well supported by scientific literature and have a proven track record of success. Correct approach analysis. The correct approach emphasizes the use of implants with a strong history of clinical success and robust scientific backing, aligning with ACT's principles of evidence-based veterinary medicine. This approach demonstrates a commitment to patient safety by selecting materials and techniques that have undergone rigorous evaluation and are known to provide predictable outcomes. It reflects a deep understanding of orthopedic principles, recognizing that implant longevity, biomechanical compatibility, and minimizing the risk of complications are paramount for successful long-term patient function. This aligns with the ACT's emphasis on maintaining high standards of surgical practice and promoting the advancement of veterinary surgery through the application of sound scientific knowledge. Incorrect approaches analysis. One incorrect approach involves prioritizing the availability of a novel implant solely based on its perceived technological advancement, without sufficient peer-reviewed data supporting its efficacy and safety in the intended application. This represents a failure to adhere to evidence-based practice, a core tenet of ACVS certification. Relying on anecdotal evidence or marketing claims over scientific validation can lead to suboptimal patient outcomes and potential harm, violating the ethical obligation to provide the highest standard of care. Another incorrect approach is to select an implant based on cost-effectiveness alone, disregarding its biomechanical suitability or historical performance data. While financial considerations are a practical reality, they should never supersede the primary responsibility to choose the most appropriate and safest implant for the patient's specific condition and anatomical needs. This approach demonstrates a lapse in professional judgment and a potential disregard for patient welfare, which is contrary to the ethical guidelines expected of ACVS diplomates. A third incorrect approach involves proceeding with an implant that has a known history of high complication rates in similar cases, simply because it is readily accessible or familiar to the surgeon. This indicates a failure to critically evaluate implant performance and a potential complacency that can jeopardize patient outcomes. The ACVS expects its certified surgeons to be aware of and actively mitigate known risks associated with surgical intervention, rather than perpetuate practices that have demonstrated poor results. Professional reasoning. Professionals facing this decision should engage in a systematic process. First, they must thoroughly assess the patient's specific orthopedic condition, considering factors such as the animal's age, breed, activity level, and the nature of the injury or pathology. Second, they should conduct a comprehensive review of the available scientific literature to identify implants and techniques with proven efficacy and a low risk of complications for the specific application. This includes consulting peer-reviewed journals, established surgical textbooks, and guidelines from professional organizations like the ACVS. Third, they should consider the biomechanical properties of potential implants and their compatibility with the patient's anatomy. Finally, they must weigh the benefits and risks of each option, prioritizing patient safety and long-term functional outcome, and document their decision-making process thoroughly. Question 8. The efficiency study reveals a statistically significant increase in surgical site infections following cystotomy procedures. As a lead surgeon responsible for the surgical team's performance and adherence to best practices, what is the most appropriate immediate course of action to address this trend? Option A. Immediately implement a new, more expensive antibiotic prophylactic regimen for all cystotomy patients, assuming the current protocol is insufficient. Option B. Conduct individual performance reviews for all surgical staff involved in cystotomy procedures to identify potential negligence contributing to the increased infection rate. Option C. Temporarily suspend all elective cystotomy procedures until the cause of the increased infection rate can be definitively determined through external consultation. Option D. Initiate a comprehensive review of the surgical team's adherence to aseptic technique protocols, sterilization procedures for surgical instruments, and post-operative wound management guidelines, and implement targeted retraining and process adjustments based on findings. Correct answer is D. Initiate a comprehensive review of the surgical team's adherence to aseptic technique protocols, sterilization procedures for surgical instruments, and post-operative wound management guidelines, and implement targeted retraining and process adjustments based on findings. Explanation: the efficiency study reveals a significant increase in surgical site infections following cystotomy procedures performed by the surgical team. This scenario is professionally challenging because it directly impacts patient welfare, the reputation of the veterinary surgical practice, and potentially the financial viability of the practice due to increased treatment costs and client dissatisfaction. The core challenge lies in identifying the root cause of the increased infection rate and implementing effective solutions while adhering to the highest standards of veterinary surgical care and ethical practice, as mandated by the American College of Veterinary Surgeons, ACV's, certification guidelines. The correct approach involves a systematic, evidence-based investigation into the surgical workflow, focusing on adherence to aseptic technique, instrument sterilization, and post-operative care protocols. This aligns with the ACT's commitment to advancing veterinary surgery through rigorous standards and continuous improvement. By meticulously reviewing each step of the process, from preoperative preparation to post-operative monitoring, the team can pinpoint deviations from best practices, implementing targeted interventions, such as retraining staff on aseptic techniques, validating sterilization processes, or refining post-operative wound management, directly addresses the identified problem and upholds the ACT's standard of providing optimal patient outcomes. This proactive and data-driven approach demonstrates a commitment to patient safety and surgical excellence, which are paramount for ACT-certified surgeons. An incorrect approach would be to dismiss the findings of the efficiency study as anecdotal or to blame individual staff members without a thorough investigation. This fails to acknowledge the systemic nature of potential issues and violates the ethical obligation to prioritize patient well-being. Blaming individuals without evidence can lead to a breakdown in team morale and a reluctance to report problems, hindering future quality improvement efforts. Another incorrect approach would be to implement broad, unverified changes without understanding the specific cause of the infections. This could lead to wasted resources, unintended consequences, and a failure to address the actual problem, thereby compromising patient care and falling short of the ACT's expectation for evidence-based practice. Furthermore, ignoring the data and continuing with the current protocols would be a direct contravention of the ACT's emphasis on continuous learning and the application of scientific principles to surgical practice. The professional decision-making process for similar situations should involve a structured approach to quality improvement. This begins with recognizing and acknowledging the problem, followed by data collection and analysis to identify the root cause. Once the cause is identified, evidence-based interventions should be developed and implemented. Crucially, the effectiveness of these interventions must be monitored and evaluated, with adjustments made as necessary. This iterative process ensures that patient care is continuously optimized and that the practice remains at the forefront of surgical excellence, in line with the rigorous standards expected of ACT-certified professionals. Question 9. The monitoring system demonstrates a slight increase in heart rate and a mild decrease in rectal temperature in a canine patient 4 hours post-ovario hysterectomy, with otherwise stable respiration and mucous membrane color. Which of the following represents the most appropriate immediate assessment and management strategy? Option A. Initiate intravenous fluid therapy at an increased rate to counteract the decreased temperature. Option B. Document the findings and consider them within normal post-operative variation without further immediate intervention. Option C. Reassess the patient in 30 minutes, focusing on pain assessment, hydration status, and surgical site integrity, while continuing to monitor vital signs. Option D. Administer an additional analgesic immediately to address the elevated heart rate. The correct answer is C. Reassess the patient in 30 minutes, focusing on pain assessment, hydration status, and surgical site integrity, while continuing to monitor vital signs. Explanation: this scenario presents a common challenge in veterinary surgical practice, interpreting physiological data post-operatively to ensure patient stability and identify potential complications. The professional challenge lies in distinguishing normal recovery fluctuations from early signs of serious issues, requiring a nuanced understanding of expected physiological responses to ovariohysterectomy and the ability to correlate multiple data points. Careful judgment is required to avoid both overintervention and underintervention, both of which carry significant risks to patient welfare and professional reputation. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's overall condition, integrating multiple vital signs and clinical observations. This aligns with the core ethical and professional responsibility to provide the highest standard of care. Specifically, it reflects a commitment to evidence-based practice by considering the patient's baseline status, the expected physiological sequelae of the procedure, and the potential for complications. This holistic evaluation allows for timely and appropriate intervention if needed, while avoiding unnecessary stress or treatment for a stable patient. Regulatory frameworks, while not explicitly detailed here as they are exam-specific and assumed to be U.S.-based for ACTs, generally mandate a standard of care that includes diligent post-operative monitoring and prompt recognition of complications. An incorrect approach that focuses solely on one isolated parameter, such as a slightly elevated heart rate without considering other factors, fails to meet the standard of comprehensive patient assessment. This could lead to unnecessary anxiety, further diagnostic tests, or even inappropriate treatments, potentially causing harm or incurring undue cost. Ethically, it demonstrates a lack of thoroughness and a failure to consider the patient as a whole. Another incorrect approach that dismisses a concerning trend, such as a persistent drop in blood pressure based on a single reassuring vital sign, represents a failure to recognize potential early signs of hypovolemia or other serious complications. This could result in delayed critical intervention, leading to significant patient morbidity or mortality, a clear breach of the duty of care. A third incorrect approach that relies solely on historical data from previous, dissimilar cases without re-evaluating the current patient's unique presentation ignores the principle of individualized patient care and the dynamic nature of post-operative recovery. This can lead to misinterpretation of current data and a failure to adapt treatment to the present situation. The professional decision-making process for similar situations should involve a systematic approach. First, establish a baseline of normal physiological parameters for the species and individual patient. Second, understand the expected post-operative changes following the specific procedure, ovariohysterectomy. Third, continuously monitor multiple vital signs and clinical indicators, looking for trends rather than isolated values. Fourth, critically evaluate any deviations from the expected norms in the context of the patient's overall condition, including pain level, hydration status, and surgical site integrity. Finally, be prepared to escalate diagnostic and therapeutic interventions promptly if concerning trends are identified, always prioritizing patient welfare and adhering to established veterinary ethical guidelines and regulatory standards. Question 10. Compliance review shows a veterinary surgeon performing a complex tumor resection on a canine patient. The surgeon prioritizes rapid excision to minimize anesthesia time, opting for technique that, while efficient, does not allow for optimal visualization of the tumor margins. Post-operatively, the tumor recurs within 6 months. Considering the principles of oncologic surgery and the standards of the American College of Veterinary Surgeons, which of the following approaches best reflects a failure to adhere to best professional practice in this scenario? Option A. Thoroughly assessing the tumor's extent preoperatively, selecting a surgical approach that maximizes the chance of complete resection with clear margins, and discussing potential adjuvant therapies with the owner. Option B. Performing a meticulous dissection to achieve wide, clear margins, even if it extends anesthesia time, and providing detailed post-operative care and follow-up. Option C. Prioritizing rapid excision to minimize anesthesia time, potentially compromising the ability to achieve optimal tumor margins, and proceeding with the surgery without extensive intraoperative margin assessment. Option D. Utilizing advanced imaging techniques to delineate tumor boundaries preoperatively, and employing specialized surgical instruments to facilitate precise tumor removal with minimal disruption to surrounding tissues. The correct answer is B. Performing a meticulous dissection to achieve wide, clear margins, even if it extends anesthesia time, and providing detailed post-operative care and follow-up. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in tumor biology and patient response to surgical intervention. The veterinarian must balance the goal of complete tumor removal with the potential for morbidity and the need to adhere to established surgical principles and ethical guidelines. The decision-making process requires a thorough understanding of oncologic principles, surgical techniques, and the specific characteristics of the tumor and the patient. Correct approach analysis. The correct approach emphasizes achieving complete tumor resection with clear margin, which is the cornerstone of successful oncologic surgery. This aligns with the ethical obligation to provide the highest standard of care and the professional responsibility to maximize the chances of a positive outcome for the patient. Adherence to established surgical principles, such as meticulous dissection, appropriate instrumentation, and careful hemostasis, minimizes iatrogenic complications and supports the goal of complete excision. The emphasis on postoperative monitoring and adjuvant therapy, if indicated, further reflects a comprehensive and evidence-based approach to cancer management, consistent with the standards expected by the American College of Veterinary Surgeons. Incorrect approaches analysis. One incorrect approach might involve prioritizing speed of resection over margin assessment. This fails to meet the professional standard of care by potentially leaving microscopic residual tumor, thereby compromising the long-term prognosis and increasing the likelihood of recurrence. This approach could be seen as a failure to exercise due diligence in achieving the primary surgical objective. Another incorrect approach could be to proceed with resection without adequately considering the potential for significant functional impairment or unacceptable cosmetic outcomes, especially if less invasive or equally effective alternatives exist. This neglects the ethical consideration of patient welfare and quality of life, which is paramount in veterinary surgery. It may also indicate a failure to adequately inform the owner of all viable options and their associated risks and benefits. A third incorrect approach might be to deviate significantly from established surgical techniques or to employ unproven methods without a strong scientific rationale or appropriate justification. This could expose the patient to undue risk and potentially violate professional standards by not adhering to best practices supported by evidence and peer consensus. Professional reasoning. Professionals should approach tumor resection by first conducting a thorough diagnostic workup to characterize the tumor and assess its extent. This informs the surgical plan, including the choice of approach, the extent of resection required to achieve clear margin, and the potential for complications. A systematic and meticulous surgical technique, guided by oncologic principles, is essential. Postoperative care should include vigilant monitoring for complications and prompt management of any issues. Finally, a discussion of adjuvant therapies and long-term follow-up should be an integral part of the overall treatment plan, ensuring comprehensive patient care. Question 11. The control framework reveals a critical need for a board-certified veterinary surgeon to manage a complex hepatic mass in a canine patient. The surgeon has identified a potential surgical approach that offers the best chance of complete tumor removal, but carries a significant risk of intraoperative hemorrhage and postoperative coagulopathy. What is the most appropriate course of action to ensure adherence to the highest standards of patient care and professional conduct as defined by the American College of Veterinary Surgeons? Option A. Initiate surgery immediately to address the mass, relying on intraoperative adjustments and experience to manage any emergent complications without extensive preoperative discussion of specific risks related to hemorrhage and coagulopathy. Option B. Perform a less aggressive surgical procedure that carries lower immediate risks, even if it means incomplete tumor removal, to prioritize immediate patient safety over long-term oncological outcome. Option C. Proceed with the technically demanding surgical approach after a thorough preoperative assessment, detailed discussion of risks and benefits with the owner, and development of a comprehensive intraoperative and postoperative management plan, including strategies to mitigate hemorrhage and coagulopathy. Option D. Postpone surgery indefinitely due to the high risk of complications, advising the owner that the risks outweigh the potential benefits without further investigation into alternative palliative care options. The correct answer is C. Proceed with the technically demanding surgical approach after a thorough preoperative assessment, detailed discussion of risks and benefits with the owner, and development of a comprehensive intraoperative and postoperative management plan, including strategies to mitigate hemorrhage and coagulopathy. Explanation. Scenario analysis. This scenario presents a significant implementation challenge for a veterinary surgeon specializing in hepatic surgery. The core difficulty lies in balancing the immediate need for a life-saving intervention with the long-term implications of potential post-operative complications, and the ethical obligation to provide the highest standard of care within the established regulatory framework. The surgeon must navigate the complexities of patient consent, resource allocation, and the potential for unforeseen outcomes, all while adhering to the stringent guidelines set forth by the American College of Veterinary Surgeons, ACVS. The pressure to act decisively in a critical situation, coupled with the need for meticulous planning and execution, makes this a professionally demanding situation requiring careful judgment. Correct approach analysis. The correct approach emphasizes a thorough preoperative assessment, including detailed diagnostic imaging and laboratory evaluation, to fully understand the extent of the hepatic pathology and the patient's overall health status. This is crucial for developing a tailored surgical plan that minimizes risks and maximizes the chances of a successful outcome. Obtaining informed consent from the owner, which includes a comprehensive discussion of the procedure, potential complications, expected outcomes, and alternative treatment options, is a fundamental ethical and regulatory requirement. Postoperative monitoring and management, including pain control, fluid therapy, and nutritional support, are essential for patient recovery and preventing complications, aligning with the ACT's commitment to patient welfare and surgical excellence. This approach reflects best professional practice by prioritizing patient safety, informed decision-making, and adherence to established veterinary surgical standards. Incorrect approaches analysis. One incorrect approach involves proceeding with surgery based solely on the urgency of the situation, without a comprehensive preoperative workup. This violates the ACT's guidelines that mandate thorough patient evaluation to ensure surgical candidacy and to formulate an appropriate plan. It also fails to adequately inform the owner about the risks and benefits, potentially leading to a breach of informed consent principles. Another incorrect approach is to delay surgery indefinitely due to a perceived high risk, without exploring all feasible management strategies or consulting with specialists. This could be considered a failure to provide timely and appropriate care, especially if the patient's condition deteriorates. It also neglects the ACT's emphasis on utilizing advanced surgical techniques when indicated and beneficial for the patient. A third incorrect approach is to perform a less invasive procedure than indicated by the pathology, simply to reduce perceived surgical risk, without a clear rationale or owner consent for this modification. This could compromise the effectiveness of the treatment and potentially lead to a worse long-term outcome, failing to meet the ACT's standard of providing the most appropriate surgical intervention. Professional reasoning. Professionals should adopt a systematic approach to complex surgical cases. This involves a thorough understanding of the ACT's certification standards and ethical guidelines. The decision-making process should begin with a comprehensive patient assessment, followed by a detailed discussion with the owner to obtain informed consent. The surgical plan should be evidence-based, considering the specific pathology, patient factors, and available resources. Post-operative care must be meticulously planned and executed to optimize recovery and minimize complications. In situations of uncertainty or high risk, consultation with ACT's board-certified surgeons or relevant specialists is a critical component of responsible practice. Question 12. The audit findings indicate a discrepancy in the sterilization logs for a set of critical surgical instruments, raising concerns about their sterility and readiness for immediate use. What is the most appropriate immediate course of action to ensure patient safety and regulatory compliance? Option A. Immediately quarantine all instruments associated with the questionable sterilization logs and initiate a thorough review of the sterilization process, including equipment functionality and staff training, before any further surgical procedures are performed. Option B. Discard all instruments that were part of the questionable sterilization logs as a precautionary measure, without further investigation into the cause of the discrepancy. Option C. Proceed with using the instruments, assuming the logs are accurate and the sterilization process was effective, and address any potential issues if they arise during surgery. Option D. Continue using the instruments but implement a more frequent visual inspection protocol before each use, while deferring a formal review of the sterilization logs to a later date. The correct answer is A. Immediately quarantine all instruments associated with the questionable sterilization logs and initiate a thorough review of the sterilization process, including equipment functionality and staff training, before any further surgical procedures are performed. Explanation: the audit findings indicate a potential lapse in the maintenance and sterilization protocols for surgical instruments, which directly impacts patient safety and the integrity of surgical procedures. This scenario is professionally challenging because it requires immediate and decisive action to rectify the situation while minimizing risk to current and future patients. The veterinarian must balance the need for thorough investigation with the urgency of ensuring all surgical equipment is safe for use. The correct approach represents best professional practice because it prioritizes patient welfare and adheres to the highest standards of veterinary surgical care. By immediately removing potentially compromised instruments from circulation and initiating a comprehensive review of sterilization logs and instrument maintenance, the veterinarian demonstrates a commitment to evidence-based practice and regulatory compliance. This proactive stance ensures that all instruments meet the stringent requirements for sterility and functionality, thereby preventing potential complications such as surgical site infections or instrument failure during procedures. This aligns with the ethical obligation to provide competent and compassionate care, as well as the implicit regulatory expectation that veterinary facilities maintain a safe and effective surgical environment. An incorrect approach that involves simply relying on the assumption that the instruments are still sterile without verification is a significant regulatory and ethical failure. This bypasses critical quality control measures and directly jeopardizes patient safety. It demonstrates a lack of due diligence and a disregard for established protocols designed to prevent iatrogenic harm. Furthermore, failing to document the investigation and corrective actions would be a breach of record-keeping requirements, hindering future audits and accountability. Another incorrect approach, such as only addressing the specific instruments flagged without a broader review of the sterilization process, fails to identify systemic issues that could lead to recurring problems. This reactive, rather than proactive, approach is insufficient for maintaining a consistently safe surgical environment and may not fully comply with the spirit of regulatory oversight aimed at preventing harm. The professional reasoning process for similar situations should involve a systematic approach. First, immediately assess and mitigate any immediate risks to patient safety. Second, conduct a thorough investigation to understand the root cause of the issue, involving review of relevant documentation and processes. Third, implement corrective actions based on the investigation findings, ensuring these actions are documented. Fourth, communicate findings and actions to relevant stakeholders, including staff and potentially regulatory bodies if required. Finally, establish or reinforce preventative measures to avoid recurrence. This structured decision-making process ensures that patient safety remains paramount while upholding professional and regulatory standards. Question 13. Risk assessment procedures indicate that a large degloving injury to the distal limb of a canine patient has resulted in significant tissue devitalization and contamination. The underlying bone is exposed but not fractured. The surgeon is considering immediate flap reconstruction to cover the exposed bone and provide soft tissue coverage. Which of the following approaches best represents a prudent and ethically sound surgical strategy? Option A. Select a free flap technique without prior wound bed preparation, prioritizing speed of closure over the assessment of tissue viability and wound environment. Option B. Attempt primary wound closure with tension, relying on the flap's inherent vascularity to overcome the challenges of the contaminated and devitalized tissue. Option C. Form aggressive debridement of all non-viable tissue. Manage the wound with appropriate dressings and potentially negative pressure wound therapy to prepare the wound bed, and then proceed with flap reconstruction once the wound environment is optimized. Option D. Immediately proceed with a large, pedicled myocutaneous flap to cover the entire exposed bone and surrounding compromised tissue, assuming the flap will revascularize and overcome the contamination. Correct answer is C. Perform aggressive debridement of all non-viable tissue, manage the wound with appropriate dressings and potentially negative pressure wound therapy to prepare the wound bed, and then proceed with flap reconstruction once the wound environment is optimized. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary surgery involving a critical decision regarding tissue viability and reconstructive options for a complex wound. The surgeon must balance the immediate need for wound closure with the long-term functional and aesthetic outcomes for the patient, all while adhering to established surgical principles and the ethical obligation to provide the best possible care. The presence of compromised tissue necessitates careful evaluation to avoid complications such as dehiscence, infection, and flap failure, which could lead to further surgical interventions and patient suffering. Correct approach analysis. The correct approach involves a staged management strategy that prioritizes wound bed preparation and stabilization before definitive flap reconstruction. This aligns with best professional practice by acknowledging the inherent risks associated with compromised tissue and the need for an optimal surgical field. By debriding non-viable tissue and managing the wound environment, e.g., with appropriate dressings and potentially negative pressure wound therapy, the surgeon creates conditions conducive to successful flap survival and integration. This staged approach minimizes the risk of flap failure due to underlying infection or poor vascularity, ultimately leading to a more predictable and favorable outcome. This adheres to the ethical principle of beneficence by prioritizing patient safety and minimizing harm. Incorrect approach is analysis. Attempting immediate primary closure of the compromised wound without adequate debridement or stabilization is a significant regulatory and ethical failure. This approach disregards the fundamental surgical principle that viable, well-vascularized tissue is essential for wound healing and flap success. It risks trapping devitalized tissue, promoting infection, and leading to flap necrosis and dehiscence, thereby violating the principle of non-maleficence. Proceeding with a large, complex flap reconstruction without addressing the underlying tissue viability issues is also professionally unacceptable. This demonstrates a failure to perform a thorough risk assessment and plan appropriately. Such an approach increases the likelihood of flap failure due to poor vascular supply or an unfavorable recipient bed, potentially requiring extensive revision surgery and compromising the patient's recovery. This represents a failure to provide competent care. Choosing a flap technique that is not well suited to the specific wound characteristics or the patient's anatomy, without a clear rationale based on the staged wound assessment, is another form of professional failure. This indicates a lack of critical evaluation of available options and a potential deviation from evidence-based surgical practice, which could lead to suboptimal outcomes and compromise patient welfare. Professional reasoning. Veterinary surgeons must employ a systematic decision-making process that begins with a comprehensive assessment of the wound and the patient's overall condition. This includes evaluating tissue viability, vascular supply, and the presence of infection. Based on this assessment, a tailored surgical plan should be developed, prioritizing wound bed preparation and stabilization before definitive reconstruction. The surgeon must consider the risks and benefits of various flap techniques, selecting the most appropriate option based on the specific clinical situation and the available evidence. Continuous reassessment throughout the perioperative period is crucial to adapt the plan as needed and ensure optimal patient outcomes. This process is guided by the ethical imperative to provide the highest standard of care and uphold the trust placed in the profession. Question 14. Comparative studies suggest that the optimal surgical approach for complex oncological resections in veterinary patients is highly dependent on a multifaceted risk assessment. Considering a scenario where a patient presents with a large, invasive tumor requiring extensive dissection, which of the following preoperative approaches best aligns with established principles of surgical risk assessment and patient welfare? Option A. Prioritizing the surgeon's personal preference or convenience over a comprehensive risk-benefit analysis for the patient. Option B. Proceeding with the surgeon's most technically familiar surgical technique without a thorough reevaluation of the patient's current risk profile or a detailed consideration of alternative, potentially less invasive or more definitive options. Option C. Delegating the primary risk assessment to junior staff without adequate supervision or independent verification of their findings. Option D. A comprehensive preoperative risk assessment that integrates patient-specific factors, surgical technique considerations, and potential post-operative management. The correct answer is D. A comprehensive preoperative risk assessment that integrates patient-specific factors, surgical technique considerations, and potential postoperative management. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critical surgical decision with potentially life-altering consequences for the patient. The surgeon must balance the immediate need for intervention with the long-term implications of different surgical approaches, considering the patient's overall health, the specific pathology, and the potential for complications. The inherent uncertainty in predicting long-term outcomes and the variability in individual patient responses necessitate a rigorous and systematic approach to risk assessment. Correct approach analysis. The correct approach, which involves a comprehensive preoperative risk assessment that integrates patient-specific factors, surgical technique considerations, and potential postoperative management, represents best professional practice. This aligns with the core principles of veterinary surgical ethics and the standards of care expected by the American College of Veterinary Surgeons, ACVS. Such an assessment ensures that the chosen surgical plan is not only technically feasible, but also ethically sound, prioritizing the patient's well-being and maximizing the chances of a successful outcome while minimizing iatrogenic harm. This systematic evaluation is crucial for informed consent and for developing contingency plans. Incorrect approaches analysis. One incorrect approach would be to proceed with the most technically familiar surgical technique without a thorough reevaluation of the patient's current risk profile or a detailed consideration of alternative, potentially less invasive or more definitive, options. This failure to adapt the surgical plan to the individual patient's evolving condition or to explore all viable alternatives constitutes a breach of the standard of care and potentially violates ethical obligations to provide the best possible treatment. Suggests a lack of due diligence in risk assessment and patient management. Another incorrect approach would be to prioritize the surgeon's personal preference or convenience over a comprehensive risk-benefit analysis for the patient. This is ethically unacceptable as it places the surgeon's interest above the patient's welfare, a fundamental tenet of veterinary medicine. Such a decision-making process would likely lead to suboptimal outcomes and could be considered professional misconduct. A third incorrect approach would be to delegate the primary risk assessment to junior staff without adequate supervision or independent verification of their findings. While teamwork is essential, the ultimate responsibility for the surgical plan and its associated risks rests with the attending surgeon. Failure to personally oversee and validate critical risk assessments can lead to oversights and errors, compromising patient safety and violating professional accountability. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough understanding of the patient's condition and the available surgical options. This involves a systematic review of diagnostic data, a critical evaluation of the risks and benefits associated with each potential surgical approach, and a consideration of the patient's physiological status and potential for recovery. The process should also include open communication with the client regarding the risks, benefits, and alternatives, ensuring informed consent. When faced with complex cases, consulting with colleagues or seeking further specialized knowledge is a sign of professional maturity and a commitment to patient care. Question 15. Assessment of a board-eligible veterinary surgeon's approach to a complex dermatologic mass excision in a canine patient, considering ACVS certification requirements when faced with multiple surgical options, including a standard excision with primary closure and a more complex reconstructive technique. Option A. Select the reconstructive technique, meticulously documenting all preoperative findings, intraoperative steps, postoperative care, and patient outcomes, and be prepared to provide a detailed rationale for its selection over simpler methods, citing relevant literature supporting its efficacy and safety for similar cases. Option B. Choose the reconstructive technique based on the surgeon's personal preference for the aesthetic outcome, without thoroughly researching its evidence-based efficacy or documenting the specific rationale for its superiority over primary closure in this particular case. Option C. Opt for the standard excision with primary closure, as it is the most straightforward technique, and focus documentation primarily on the immediate postoperative appearance without extensive detail on the decision-making process or long-term outcome monitoring. Option D. Employ a novel, unproven surgical modification for the excision, documenting the procedure briefly and assuming the ACVS will recognize the innovation without requiring extensive supporting data or justification. The correct answer is A. Select the reconstructive technique, meticulously documenting all preoperative findings, intraoperative steps, postoperative care, and patient outcomes, and be prepared to provide a detailed rationale for its selection over simpler methods, citing relevant literature supporting its efficacy and safety for similar cases. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between providing optimal patient care and adhering to the strict guidelines of the American College of Veterinary Surgeons, ACVS, regarding surgical procedures and documentation. The surgeon must balance the immediate needs of the patient with the long-term implications of their surgical choices, and their ability to justify those choices within the ACVS certification framework. The complexity arises from the need to select a surgical technique that is not only technically sound and beneficial to the patient, but also aligns with established ACVS standards for reporting and justification, particularly when deviating from conventional methods. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient welfare while meticulously adhering to the ACVS regulatory framework. By selecting a well-documented, evidence-based surgical technique that is widely accepted within the veterinary surgical community, and for which comprehensive pre- and post-operative data can be collected, the surgeon ensures that the procedure is both ethically sound and defensible under ACVS standards. This approach allows for clear justification of the surgical decision-making process, facilitates objective assessment of outcomes, and aligns with the ACVS commitment to maintaining high standards of surgical competence and ethical practice. The emphasis on thorough documentation and the ability to present a clear rationale for the chosen technique are paramount for successful ACVS certification. Incorrect approaches analysis. An incorrect approach that involves employing an experimental or novel surgical technique without prior extensive peer review or established evidence of efficacy and safety would be professionally unacceptable. This fails to meet ACVS standards for evidence-based practice and could jeopardize patient safety. Such an approach would likely lack the robust data required for justification and could be viewed as a deviation from established surgical principles without adequate scientific backing, potentially leading to a failed certification review. Another incorrect approach would be to perform a standard surgical procedure, but neglect to meticulously document all aspects of the surgery, including preoperative findings, intraoperative details, and postoperative management and outcomes. This failure in documentation directly contravenes ACVS requirements for comprehensive case reporting. Without detailed and accurate records, the surgeon cannot adequately demonstrate their surgical skill, decision-making process, or the patient's response to treatment, which are critical components of the certification evaluation. This lack of thoroughness undermines the integrity of the surgical record and the surgeon's ability to present a complete and compelling case for certification. A further incorrect approach would be to select a surgical technique based solely on personal preference or perceived ease of execution, without considering the evidence-based efficacy, potential complications, or the availability of comparable data for justification within the ACVS framework. This approach prioritizes convenience over patient benefit and regulatory compliance, demonstrating a lack of critical evaluation and adherence to the rigorous standards expected of ACVS diplomates. It fails to demonstrate the surgeon's commitment to advancing veterinary surgical knowledge and practice through evidence-based decision-making. Professional reasoning. Professionals facing similar situations should adopt a systematic decision-making process. First, they must thoroughly assess the patient's condition and identify all potential treatment options. Second, they should consult current veterinary surgical literature and guidelines to identify evidence-based techniques that are most appropriate for the specific condition and patient. Third, they must consider the ACVS certification requirements, including the need for well-documented cases and the ability to justify surgical choices. Fourth, they should select the technique that offers the best balance of patient welfare, efficacy, safety, and compliance with ACVS standards. Finally, meticulous documentation throughout the entire process is essential for successful case presentation and certification. Question 16. When evaluating a canine patient with a suspected mediastinal mass identified on thoracic radiographs, which of the following diagnostic and surgical approaches best aligns with current best practices and the standards expected by the American College of Veterinary Surgeons. Option A. Obtain a fine needle aspirate (FNA) of the mass via a percutaneous approach, and if cytology is inconclusive, proceed with surgical resection without further imaging. Option B. Perform a computed tomography (CT) scan of the thorax with contrast to fully characterize the mass, its vascularity, and its relationship to adjacent structures before planning surgical intervention. Option C. Schedule the patient for a rigid bronchoscopy to assess the mass's effect on the trachea, and then proceed with surgical removal based on visual inspection alone. Option D. Proceed directly to surgical exploration and debulking of the mass, as the radiographic findings are sufficient to warrant intervention. The correct answer is D. Proceed directly to surgical exploration and debulking of the mass, as the radiographic findings are sufficient to warrant intervention. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent risks associated with mediastinal surgery in a veterinary patient. The complexity of the mediastinum with its vital structures, heart, great vessels, trachea, esophagus, lymph nodes, and nerves, demands meticulous surgical planning and execution. The potential for intraoperative complications, such as hemorrhage, pneumothorax, or damage to adjacent organs, is significant. Furthermore, the diagnostic uncertainty regarding the exact nature and extent of the mediastinal mass adds a layer of complexity, requiring a surgeon to be prepared for various intraoperative findings and potential therapeutic adjustments. The need to balance the potential benefits of surgical intervention against the significant risks, while ensuring the patient's welfare and adhering to established veterinary surgical standards, is paramount. Correct approach analysis. The correct approach involves a thorough preoperative assessment, including advanced imaging, CT scan with contrast, is crucial for detailed anatomical evaluation and vascularity assessment, and potentially biopsy if safe and feasible. This is followed by a carefully planned surgical approach, often utilizing a sternotomy or thoracotomy, with meticulous dissection to identify and preserve vital structures. The decision to resect the mass, debulk it, or obtain tissue for definitive diagnosis is made based on intraoperative findings and preoperative information. Postoperative care must be intensive, focusing on respiratory support, pain management, and monitoring for complications. This approach represents best professional practice because it prioritizes patient safety through comprehensive evaluation and planning, minimizes iatrogenic injury through careful surgical technique, and ensures appropriate management of potential complications, aligning with the ethical obligations of veterinary surgeons to provide competent and compassionate care. Adherence to established surgical protocols and guidelines for thoracic and mediastinal surgery, as taught and expected by the American College of Veterinary Surgeons, is fundamental. Incorrect approaches analysis. Proceeding with surgery without obtaining detailed imaging like a CT scan would be a significant regulatory and ethical failure. This lack of information prevents adequate surgical planning, increases the risk of unexpected findings leading to intraoperative complications, and may result in an incomplete or inappropriate intervention. It violates the principle of informed consent, as the full extent of risks and benefits cannot be accurately conveyed without proper diagnostics. Attempting a blind or exploratory surgery without a clear surgical plan or understanding of the mass's relationship to surrounding structures is also professionally unacceptable. This approach demonstrates a lack of due diligence and a disregard for patient safety, increasing the likelihood of damaging vital organs and leading to severe morbidity or mortality. It falls short of the expected standard of care for a complex surgical procedure. Forming a limited or incomplete resection when a complete excision is feasible and indicated, based solely on perceived ease of access or time constraints, would be a failure to provide optimal surgical care. This can lead to recurrence of the disease and necessitate further, potentially more complex, interventions. It compromises the long-term prognosis for the patient and is contrary to the goal of achieving the best possible outcome. Professional reasoning. Professionals should approach such cases by first establishing a comprehensive diagnostic database. This includes detailed history, physical examination, and advanced imaging. Based on this information, a surgical plan should be formulated, considering potential complications and contingency measures. The decision to proceed with surgery should be based on a risk-benefit analysis, with clear communication of these risks and benefits to the owner. Intraoperatively, Meticulous technique and constant vigilance are required. Post-operative care must be tailored to the specific needs of the patient. This systematic approach ensures that decisions are evidence-based, patient-centered, and aligned with the highest standards of veterinary surgical practice. Question 17. Cost-benefit analysis shows that a less expensive monofilament absorbable suture material is available for a routine gastrointestinal anastomosis. However, the surgeon is highly experienced with a braided, multifilament, absorbable suture, known for its excellent handling characteristics and reduced knot slippage in this specific tissue type. The surgeon also has a strong preference for a particular inverting suture pattern that is optimally performed with the braided material. Considering the ACT certification's emphasis on patient outcomes and evidence-based practice, which approach best reflects professional judgment? Option A. Utilize the braided, multifilament, absorbable suture material and the preferred inverting suture pattern, acknowledging the surgeon's expertise and the material's proven efficacy in this context, even if it incurs a slightly higher material cost. Option B. Employ the less expensive, monofilament, absorbable suture material, but attempt to replicate the surgeon's preferred inverting suture pattern using a different knot tying technique. Option C. Select the less expensive, monofilament, absorbable suture material to minimize surgical costs, assuming it will perform adequately for the gastrointestinal anastomosis. Option D. Opt for a non-absorbable suture material for the anastomosis to ensure long-term tissue integrity, despite the potential for foreign body reaction. The correct answer is A. Utilize the braided, multifilament, absorbable suture material and the preferred inverting suture pattern, acknowledging the surgeon's expertise and the material's proven efficacy in this context, even if it incurs a slightly higher material cost. Explanation. This scenario presents a common challenge in veterinary surgery, where the selection of suture materials and techniques directly impacts patient outcomes, surgical efficiency, and resource allocation. The professional challenge lies in balancing the ideal surgical outcome with practical considerations such as cost, surgeon familiarity, and potential for complications. The American College of Veterinary Surgeons, ACVS, certification emphasizes not only technical proficiency, but also the ability to make sound, evidence-based decisions that prioritize patient welfare within a realistic practice environment. The correct approach represents best professional practice because it prioritizes patient safety and efficacy through the selection of a material and technique that is well suited to the specific tissue type and surgical goal, while also considering the surgeon's expertise and the availability of resources. This aligns with the ACT's commitment to advancing veterinary surgery through rigorous standards and the promotion of evidence-based practice. The chosen material and technique should be supported by current literature and clinical experience, ensuring the best possible outcome for the patient with minimal risk of complications. An incorrect approach that prioritizes cost savings above all else, without adequate consideration for tissue compatibility or surgeon proficiency, represents a significant regulatory and ethical failure. This could lead to increased morbidity, prolonged healing times, or even catastrophic surgical failure, all of which violate the fundamental duty of care owed to the patient. Similarly, selecting a technique solely based on surgeon preference or familiarity, without regard for its suitability for the specific surgical site or tissue, can result in suboptimal outcomes and potential complications, again falling short of professional standards. Choosing a material with a known higher risk of adverse tissue reaction or dehiscence for a particular application, even if less expensive, is also a failure to adhere to best practices and patient safety. The professional decision-making process for similar situations should involve a systematic evaluation of the surgical problem, considering the specific tissue characteristics, the desired outcome, available materials and their properties, tensile strength, absorption profile, tissue reactivity, established surgical techniques, and the surgeon's own skill set and experience. Consulting relevant literature, considering the patient's individual circumstances, and engaging in a thorough risk-benefit assessment are crucial steps. This iterative process ensures that the chosen suture material and technique are not only technically sound, but also ethically justifiable and aligned with the highest standards of veterinary surgical care. Question 18. The risk matrix shows a moderate likelihood of implant loosening with a standard plate and screw construct for a comminuted tibial fracture in a large breed, active dog. The client has expressed concern about the overall cost of treatment. Which of the following approaches best aligns with the professional standards and ethical obligations of a veterinary surgeon certified by the American College of Veterinary Surgeons? Option A. Suggest a less invasive fixation method, such as external coaptation, despite the comminuted nature of the fracture, to significantly reduce immediate surgical costs, without fully detailing the increased risks of non-union and malunion associated with this approach for this specific fracture type. Option B. Recommend a bone plate and screws that are appropriately sized and contoured for the fracture, utilizing lag screw principles where indicated, and thoroughly discuss the potential for implant loosening and the importance of post-operative activity restriction with the client, along with alternative fixation methods if available and suitable. Option C. Advise the client that the risk of implant loosening is acceptable given the dog's activity level and the cost savings, and proceed with the standard plate and screw construct without further discussion of alternatives or specific post-operative management. Option D. Proceed with the standard plate and screw construct, opting for the least expensive implant option available to mitigate the client's cost concerns, and defer detailed discussion of potential complications until after the surgery. Correct answer is B. Recommend a bone plate and screws that are appropriately sized and contoured for the fracture, utilizing lag screw principles where indicated, and thoroughly discuss the potential for implant loosening and the importance of post-operative activity restriction with the client, along with alternative fixation methods if available and suitable. Explanation. This scenario presents a professional challenge due to the inherent risks associated with open reduction and internal fixation ORIF in veterinary surgery, particularly concerning patient outcomes and client expectations. The complexity arises from balancing surgical necessity, potential complications, and the financial implications for the client, all within the ethical and professional standards set by the American College of Veterinary Surgeons, ACVS. Careful judgment is required to ensure that the chosen fixation method aligns with the patient's specific needs, the surgeon's expertise, and the available resources, while maintaining transparency with the client. The correct approach represents best professional practice because it prioritizes a thorough preoperative assessment and a tailored surgical plan. This includes considering the biomechanical demands on the implant, the patient's overall health, and the potential for complications such as infection, implant failure, or non-union. Adhering to established surgical principles and utilizing appropriate implants and techniques, as guided by ACVS standards and best practices, minimizes risks and maximizes the likelihood of a successful outcome. This approach demonstrates a commitment to patient welfare and professional competence. An incorrect approach that involves selecting an implant solely based on cost or availability, without a comprehensive assessment of its suitability for the specific fracture pattern and patient, represents a significant regulatory and ethical failure. This could lead to implant failure, delayed healing, or the need for revision surgery, thereby compromising patient welfare and potentially violating the ACVS commitment to excellence in surgical care. Another incorrect approach, such as proceeding with surgery without fully discussing the risks, benefits, and alternatives with the client, constitutes a failure in informed consent and client communication, which are fundamental ethical obligations. This lack of transparency can lead to misunderstandings and dissatisfaction, undermining the trust essential in the veterinarian-client relationship. Professional decision-making in such situations should involve a systematic process. 1. Comprehensive patient evaluation, including imaging and assessment of overall health. 2. Identification of all viable surgical options, considering their respective risks and benefits. 3. Selection of the most appropriate fixation method based on fracture type, patient factors, and surgeon expertise. 4. Detailed discussion with the client regarding the proposed plan, including potential complications and expected outcomes. 5. Meticulous surgical execution and diligent post-operative care. Question 19. Upon reviewing the radiographs of a complex comminuted fracture in a young canine limb, you have assessed that a closed reduction technique might be technically feasible, but carries a significant risk of instability and malunion. The owner has expressed significant financial constraints. What is the most ethically and professionally sound approach to managing this situation? Option A. Thoroughly discuss the specific fracture characteristics, high risk of failure and potential complications associated with closed reduction, the benefits and risks of open reduction, and the associated costs for both, ensuring the owner understands the implications of each choice before proceeding with a mutually agreed-upon plan. Option B. Proceed with closed reduction, as it is the less invasive and initially less expensive option, hoping for a successful outcome to manage the owner's financial concerns. Option C. Advise the owner that due to the complexity and financial limitations, the best course of action is euthanasia, without fully exploring all surgical possibilities. Option D. Recommend immediate open reduction and internal fixation, explaining that it offers the best chance of a successful outcome, without extensively detailing the potential for closed reduction success or its associated risks. The correct answer is A. Thoroughly discuss the specific fracture characteristics, the high risk of failure and potential complications associated with closed reduction, the benefits and risks of open reduction, and the associated costs for both, ensuring the owner understands the implications of each choice before proceeding with a mutually agreed-upon plan. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in veterinary surgery, where a surgeon must balance the immediate need for stabilization with the long-term welfare and financial considerations for the client. The challenge lies in the potential for a closed reduction to fail, leading to further complications and increased costs, versus the immediate financial burden and potential risks associated with an open reduction. The surgeon's duty of care extends to providing accurate prognoses and discussing all viable treatment options, including their respective risks, benefits, and costs, in a manner that allows the client to make an informed decision. Correct approach analysis. The correct approach involves a thorough discussion with the owner about the specific fracture type, the likelihood of success with closed reduction based on radiographic evidence and biomechanical principles, and the potential complications of both closed and open reduction techniques. This includes explaining the rationale for recommending a particular approach, outlining the post-operative care requirements, and providing a realistic prognosis for each option. This aligns with the ethical principles of informed consent and client autonomy, ensuring the owner can make a decision that best suits their animal's needs and their personal circumstances, while upholding the surgeon's professional responsibility to provide the highest standard of care. The American College of Veterinary Surgeons, ACVS, emphasizes evidence-based practice and clear communication in all surgical decision-making. Incorrect approaches analysis. One incorrect approach would be to proceed with closed reduction without a detailed discussion of the risks and alternatives, especially if the fracture pattern suggests a low likelihood of success with this method. This fails to obtain truly informed consent and could be seen as a breach of the surgeon's duty to the client and patient, potentially violating ethical guidelines regarding transparency and client communication. Another incorrect approach would be to immediately recommend open reduction without first thoroughly evaluating the potential for a successful closed reduction and discussing it as a viable, albeit potentially less predictable, option. This could be perceived as prioritizing a more complex and potentially more profitable procedure over the client's financial concerns or the patient's immediate needs, and it bypasses the ethical obligation to explore all reasonable treatment avenues. A third incorrect approach would be to defer the decision entirely to the owner, without providing sufficient professional guidance and a clear recommendation based on the surgeon's expertise. While client autonomy is important, the surgeon has a professional and ethical obligation to guide the owner through the decision-making process by presenting the medical facts and their implications clearly. Professional reasoning. Professionals should approach such dilemmas by first conducting a comprehensive diagnostic assessment. This is followed by a structured discussion with the client, beginning with the diagnosis and prognosis. The surgeon should then present all medically appropriate treatment options, detailing the advantages, disadvantages, risks, and expected outcomes of each. The surgeon's professional opinion and recommendation should be clearly articulated, but the final decision rests with the owner after they have been fully informed. This process ensures ethical practice, client satisfaction, and optimal patient welfare. Question 20. During the evaluation of a large breed dog with a complex, contaminated degloving wound of the distal limb, the owner expresses significant financial limitations and states they can only afford basic wound care and antibiotics. The veterinarian has identified several advanced wound management options, including vacuum-assisted closure, vac therapy, and reconstructive surgery, which would offer a better prognosis but are considerably more expensive. The owner is clearly distressed by the cost of advanced care, What is the most ethically and professionally appropriate course of action for the veterinarian? Option A. Strongly advocate for the most advanced and expensive treatment options, emphasizing the potential for a superior outcome, and encourage the owner to seek financial assistance or financing to cover the costs. Option B. Proceed with the owner's requested basic wound care and antibiotics, without extensively discussing the potential benefits of more advanced treatments, to avoid causing further distress about costs. Option C. Recommend euthanasia for the animal due to the financial limitations preventing optimal wound management, as a compromised outcome could lead to prolonged suffering. Option D. Discuss the risks and benefits of all available treatment options, including the advanced techniques and the owner's preferred basic care, clearly outlining the potential outcomes and limitations of each, and collaboratively develop a treatment plan that aligns with the owner's financial capacity while prioritizing the animal's welfare. The correct answer is D. Discuss the risks and benefits of all available treatment options, including the advanced techniques and the owner's preferred basic care, clearly outlining the potential outcomes and limitations of each, and collaboratively develop a treatment plan that aligns with the owner's financial capacity while prioritizing the animal's welfare. Explanation. This scenario presents a professional challenge due to the inherent conflict between the owner's financial constraints and the veterinarian's ethical and professional obligation to provide the best possible care for the animal. The veterinarian must navigate these competing interests while adhering to the standards of practice and ethical guidelines set forth by the American College of Veterinary Surgeons, ACVS. The core of the dilemma lies in balancing the client's ability to pay with the animal's welfare and the veterinarian's professional judgment regarding wound management. The correct approach represents best professional practice because it prioritizes the animal's well-being and upholds the veterinarian's duty of care. It involves open and honest communication with the owner, exploring all viable treatment options within the owner's financial limitations, and documenting the discussion and decisions thoroughly. This approach aligns with ethical principles of beneficence, acting in the animal's best interest, and non-maleficence, avoiding harm, as well as professional standards that require informed consent and client education. The ACVS, through its commitment to excellence in surgery and animal welfare, implicitly supports such a client-centered yet animal-focused approach. An incorrect approach that involves proceeding with a suboptimal treatment plan without fully exploring alternatives or ensuring the owner's understanding of the risks and benefits would be professionally unacceptable. This could be considered a failure of the duty of care and informed consent, potentially leading to a worse outcome for the animal and a breach of professional ethics. Another incorrect approach, such as pressuring the owner into a more expensive treatment than they can afford, would violate principles of client autonomy and could lead to financial hardship and distrust. Failing to document the discussion and the agreed-upon plan would also be a significant professional failing, leaving the veterinarian vulnerable and hindering continuity of care. The professional decision-making process in such situations should involve a systematic evaluation of the animal's condition, a clear understanding of the owner's financial situation and priorities, and a comprehensive assessment of all available treatment options, including their respective prognoses, risks, and costs. Open and empathetic communication is paramount. The veterinarian should present a range of options, from the ideal to the most financially feasible, clearly explaining the implications of each. Documentation of all discussions, decisions, and the rationale behind them is crucial for legal and ethical protection, as well as for ensuring clear communication among all parties involved in the animal's care.